All right, I guess it's 7 o'clock, and I'm not sure if everybody can hear me. If you can't, let me know. I know everybody is pretty stressed about the COVID-19 and what that means for their practice, as well as what it means for your pets from a client perspective. We recently did some telemedicine, and I wanted to share how that went with you because I feel that it went well, and I feel like it's a good option for clinics who are trying to reduce their traffic within their clinic and try and keep social distancing within their clinic as well. So in Ontario, anyways, we were listed as essential service. That doesn't mean we have full reign to see whoever and have clients within the practice, and we're being very, very careful with our biosecurity. But our college has let us do a little bit more telemedicine and have a little more reign with that. So that's what we are trying to do. And I was going to kind of share my experience and we're doing within our clinic. So we are referral only, and we only accept clients if they come with a referral. We are still mandating that as far as telemedicine. So to make things easier, we usually require a referral form filled out. We are accepting emails from referral clinics or from some of the big centers, just because not everyone is having access to their records at home. So if they can email a brief history, x-rays if possible, so we have all of that ahead of time. Once we have that, what we're doing is emailing the client and communicating with them, and then we will invoice them. So we let them know how much it's going to be for a consult. Our consults aren't as long as an initial consult when they come into the clinic, but it does take a lot of time to sort through all the information and the x-rays, so we do that ahead of time. And then we invoice them and they e-transfer us the amount. So once we have that, Zoom is pretty easy to use, and you can set up an appointment time. And all we did was email the client the appointment time, the password, and then at that time they logged on. We were able to visually assess the patient. So we had the client walk through what everything looks like at a walk, a trot. We can make them do transitions to make things easier for them too, because some clients may not know what you want of them. We have put videos on our YouTube site, so then we can send them there, or we can send them links to the specific videos we require, and so at least they know what to expect when we do talk to them. And then it's going to depend. So, I mean, the biggest thing is the referral centers aren't accepting minor surgeries, orthopedic surgeries, so cruciates, FHOs, anything like that that's non-emergent. And some of these people have been waiting for assessments from the surgeons for a while, and they're stressed, and I get that. So at least by video, we can see, are these clients, or are these patients three-legged lame? Can we see what leg they are lame on? Is it something we can manage that, or that needs to be managed with rest and medications, which we can then prescribe them? Or are they at a point that we can potentially start developing a little bit of a minor exercise program for them, whether that is just starting to include walks, whether that's weight shifting, and having all of those videos pre-done from a veterinary standpoint on your site, your website, your YouTube channel, whatever, so that your clients have access and know what it is they're supposed to. Are, I think, my biggest concern right now, because I know the stress that they seem to have when they either have the accident or post-surgery, and not having any guidance, I think, is going to be a concern for a lot of these patients and clients. So being able to at least assess, are these clients being or patients being confined? Do they have access to stairs? Do they have slippery floors? Are they ataxic, or are they completely non-ambulatory? And even walking your client through the ability to do a conscious proprioception test, a withdrawal test, and and see what they are capable of doing. It is, none of this is ideal. It's definitely, I prefer to have my hands on patients and be able to feel things for myself and know exactly what's going on. It's way easier to have them in clinic with their pet owner, but unfortunately we are severely restricted right now. And so this is just giving us another option for those patients. I don't have too much more to say. I don't know if anybody has any questions. So that's kind of where we're at right now. I don't know what the different kind of requirements are either by state or by province. I just know that the one that I did was an agility dog that had a 2-week period of rest for tibial crest avulsion and was doing really, really well. I had all the information ahead of time. Because it was a puppy, she was a little bit concerned that she might not be able to get the puppy to do what we wanted to do during the appointment. So it was all done ahead of time. I sent her the exercises and transitions I wanted her to be able to reproduce. And then she videotaped those and sent them to me. So I had all of those, and the dog now has an exercise program for the next, and then we will change that at the 2-week mark. That's about it. I think we have the potential to at least help stave off some of the stress that these clients are undergoing and keep an eye on our patients and make sure that they're progressing okay or not declining. The other thing that we are considering doing from a telemedicine perspective is that if we have a consult through telemedicine, they pay their fee, which is significantly less than what an initial consult is with treatment. Then what we would do is, if we determine that this dog really is painful and really needs to come in for a better assessment and maybe some laser and some acupuncture and things like that, then we would waive the portion that they've already paid towards the assessment when they come in, if that makes sense. Alternatively, I know a lot of you are using CC loops and LED light clusters and things like that. Any sort of PEMF that we can get these clients to be able to use at home and help control their pain and their inflammation for as long as we can between appointments is going to help out as well. So, questions, concerns? Is anybody doing telemedicine? I know regular clinic-wise, I think their telemedicine looks a little different. I think their telemedicine is more phone call screening. I think just with rehab and what we do pain management-wise, I think having a visual of that is a little bit more important. It's not like we're screening, are they vomiting, are they diarrhea? I think we need to have those things in place. So I think Zoom was fantastic and really, really easy to use. My client, although she had never used anything like that before either, it seemed to be fairly seamless once we figured out how to turn her volume on. And I think e-transfers were super easy too, as far as sending an invoice really, really quickly. I don't know how many people have electronic medical records, but also she had that on hand. Any thoughts? I know I was talking to someone about house calls. I think it's definitely something in this area for sure that people are stopping just because of how prevalent the virus is in Ontario. And I think at this point, although we're considered essential, things change every single day, and having something as a backup, just in case the government decides that we are no longer essential, is super important, because we don't want to lose these patients and we don't want to lose these clients either. Well, guys, If no one has any questions, I don't have too much else to say. I'm not sure. I know a lot of rehab places are requiring closure in this area. Either they don't have a veterinarian on staff, or their patients are fairly stable and non-essential to come in. So I think, we have to evaluate that. We are trying to not book appointments that are doing well. It's tough. It's want to come in, but we're dealing with very stressed animals too, who are used to coming in with their parents, and so we're just trying to make it as seamless as possible. I guess if nobody else has any questions, I don't see anything being typed. All right. Good luck, everybody.